Hello everybody, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist, and let me discuss whether every woman should have a pap smear. Now, what is pap smear? First, we need to understand that pap smear is a screening test. What we mean by a screening test is a test which is done before actually the symptoms develop. So, pap smear screens for cervical cancer before it actually develops. What is done in pap smear? Basically, what is done in pap smear is that scrapings are taken from the lower end of the uterus or the cervix. This is done by first inserting a speculum inside the vagina, opening it up, and then inserting a brush or a spatula into the cervix and scraping out few cells and then putting it over a slide and sending it to the pathologist for examination. It's a very easy test, doesn't take very long, quite painless and easy to do. What are the benefits of pap smear? Now, most cervical cancers are caused by the human papilloma virus. Now, once the virus infects, it causes certain changes in the cervix, which later on, over many years, can lead on to the development of cervical cancer. Normally, these changes can happen over 10 to 20 years. By doing pap smear, we can detect if the lady has these changes, which over time can go on to become cervical cancer. And if it is detected that she has these changes, then appropriate treatment can be instituted. So, because of the long natural history of this one changes between cervical cancer, HPV infection and development of cervical cancer, pap smear is very effective in picking up these changes before the cancer develops. The pap smear result, when sent to the pathologist, the report may come as normal, or the pathologist may tell that certain precancerous changes have happened. These can be low-grade changes or high-grade changes. The high-grade changes obviously have more risk of developing cervical cancer. Or in certain cases, we may find that the cancer has actually developed. So, depending on these changes, we can institute appropriate treatment. In many cases, the treatment will be far lesser than what is required for cervical cancer. Like just what we call as LEAP, or just scraping off of the entire tissue, can be done as against full removal of the uterus. So as you can see, pap smear is a highly effective test which can detect precancerous changes before the actual cervical cancer develops. It has been studied over many years now, at least as far as I can remember, past 30 or 40 years. And it can help save lives by detecting this cancer at a very early stage. How frequently is it to be done? Normally, it is included along with the annual health checkup. But if continuously the pap smears are normal, the frequency can be increased to 2 years or 3 years. Nowadays, along with the pap smear, the HPV testing is also done. The same tissue is also sent for human papilloma virus, because the two subtypes, 16 and 18, which are responsible for most of the cervical cancer, we can see whether infection has happened by these specific subtypes of human papilloma virus, so that appropriate treatment can be instituted. So what I would say is that definitely every lady who is sexually active should have an annual pap smear, because it's a fairly easy test and it definitely helps in detection and prevention of early cancerous changes. So, thank you.